Summer's still in full swing, so too are outdoor activities that all too often put our skin at risk. Cosmetic surgeon Dr. Scheiner joins us to discuss the dangers the sun can cause and new advancements in technology helping to counteract that damage. Dr. Scheiner, thanks so much for being with us today.
Thank you so much for having me.
You know, most people know that exposure to the sun can lead to skin cancer, but what exactly is it that causes this to happen?
When the sun shines down on the earth, it's composed of multiple wavelengths of light. Some are visible, allowing us to see one another, and other are invisible. Most important amongst these are the ultraviolet or UV wavelengths. These include UVC, UVB, and UVA. UVC is primarily absorbed by the ozone. UVB is a wavelength that makes our skin red, B for burn, most prevalent from around 10 to 4 p.m. UVA is a long wavelength that can penetrate deep in our skin where it fractures elastic and collagen fibers, allowing our skin to sag and droop. A for aging. It's present all day long and can even penetrate clouds and car windows. These UV rays can bind together parts of the DNA in the basal cell layer of the epidermis, the top layer of our skin, where it creates something called thiamine dimers. It makes the skin irregular, leading to basal cell and squamous cell skin cancers. Interestingly, in the 70s, 80s, sunscreens came around that allowed us to stay on the sun longer without getting red because its components blocked UVB rays. But we saw skin cancer rise. This was because it was blocking just one of the dangerous UV rays. It was blocking UVB, so we weren't getting red, but it allowed UVA to penetrate unimpeded. Recently, we do have ways to penetrate against UV, to protect against UVA and UVB using titanium dioxide and zinc oxide. These are mechanical sunblocks that work immediately when applied to the skin and are safe for the reefs in the ocean.
Yeah, so we want to know, what can we do? What are some of the new advances for removing sun damage?
Absolutely. There's a medication known as Retin A that's been around for a while that can reverse some of the damage. There's a product called Broad-Based Light, BBL Forever Young, by a company called Cyton. They have found that treatment, which doesn't have any downtime, can cause the skin to revert back to a younger genetic state while it gets rid of brown and red spots anywhere on the body. And then I have something called Reset for Sun Damage, where I use a laser to remove years of sun damage and allow the skin to come back healthier and more attractive looking.
How does that laser procedure you were talking about that you use help remove pre-cancers and early skin cancers?
Sure. Most of the damage from the ultraviolet rays is to the top layer of our skin, lies in the basal cell layer. When I use a laser to treat the skin, I remove the basal cell layer and all the damage above it. When the body regrows this layer, it grows it with brand new cells that have never seen the sun before. It improves both the appearance of the skin with tighter skin and new collagen and elastic fibers, and the health of the skin, where it removes precancers and some active skin cancers as well. That's why I call it Reset for Sun Damage.
What are some signs that we all should be looking for and monitoring that could indicate we have a problem with skin cancer?
Sure. There are flaky lesions on the chest and face called actinic keratoses. 10% of these will go on to form squamous cell carcinomas. Rolled pearly edge lesions are suspicious for basal cell carcinomas. And then there are melanomas. And melanomas are often, interestingly, in non-sun exposed areas, and they're looking for lesions that are asymmetric, have an irregular border, different colors in the lesion, and greater than 1/4 inch in diameter.
Okay, so talk to us about sunscreen. What do you like? What is better? Which one's better than others that really work?
Absolutely. Mechanical blocks are things that contain titanium dioxide and zinc oxide. They actually reflect the light directly, and they work immediately when they're put on the skin. Interestingly, in Hawaii, they're not allowing anything but these mechanical blocks because the other sunblocks, which get absorbed in the skin, they're called active blocks, they actually hurt the reefs in the ocean.
Oh, wow. Okay, so beyond sunscreen, the right kind of sunscreens, what else should we be doing to protect our skin?
Sure. Being aware of the hours that we're outside. So if you're golfing or boating, if you do that earlier in the day or later in the day, wearing hats, clothing that's protective against the sun. There's one called Sun Precautions that has comfortable clothing that allows air to go underneath it. And then sunglasses are really important whenever we're outside. The sun can hurt the eye too, causing things as pinguecula or pterygia. These are growths that happen on the white part of the eye that can actually grow over the clear part of the eye. So wearing sunglasses whenever outside is really important as well.
Wow, a lot to think about, but it's very important. Dr. Scheiner, thanks so much for sharing this with us on Studio 3.
Thank you so much.